third scenario today comes from Katherine, so I'll pass it over to you.
Thank you. So, Will, one of the things we've been looking at as part of this strength-based practice is not just information and guidance, but also how you find out about products and services.
The discovery seems to be the real challenging part, just at this early stage.
Yeah, definitely. And one of the things for people suffering with cancer or MS or any of these very complex conditions is that you've got a whole range of things that you go through, from diagnosis through treatment and then and then beyond. And there are actually lots of organisations and companies who've got products tailored to those conditions. And so, taking cancer as an example, we found that there's an organisation that's set up about a year ago. Avril Chester set it up. She'd had a cancer diagnosis and treatment in 2015-16, and following that, she had been working as the IT director for Scope, and her experiences when she first had her diagnosis and treatment was that finding things was actually very difficult. And even though she had a technical background and was very technically literate, knowing what search terms to put into Google to find particular
communities or health information.
For health information, she was looking for particular products. She was particular. So, for instance, a friend of mine was looking for travel insurance. She'd got cancer, and so it's that type of thing where you're looking for something quite tailored.
Yeah.
And her initial findings were that it was actually really easy to find things in the States, for instance, when you Google search, but actually she was in the UK. Yeah. Different cancer conditions have got different kind of services appropriate to them.
Yeah.
I've got a friend who's just had breast cancer, and trying to find wigs that are appropriate is actually more difficult than you might find or think. So Cancer Central was set up in 2018. It's got a different business model. It's to mine, for instance. It's not a charity, it's a community interest company. Yeah. 65% of its profits will go back into the organisation in due course, and it's specifically set up to enable businesses to market their services to people with a cancer diagnosis. It's got a very powerful search engine. It's using IBM Watson.
Yep.
And it's been very successful so far, early days, but in terms of a portal that directs you for someone with a cancer diagnosis in the UK to services that are particularly designed around you, it seems to be certainly out there as a very interesting one to follow and watch.
So it's somewhat of a sort of an Amazon-style marketplace, in addition to being other things as well?
I guess a little bit, although it's almost like a combination of a peer-to-peer network and a community of interest and providing services. So yes, it's a little bit like Amazon. You can't buy services directly from Cancer Central. It points you to, so it acts more like a marketplace.
A bit like a confused.com or...
I guess so, yes.
The meerkats.
Yes, definitely. And one of the things, the search engine allows you to put in your location, the particular cancer diagnosis you've got, but also the stage of cancer you're at. Because different products are appropriate to different cancer stages. So it's been, clearly very well thought through from the perspective of someone who's had cancer, but also someone who's got a clear technical vision in terms of how this can support people.
Is there any volunteering or community aspect to the platform?
Yes, that's a real strength of it. So they've been working with over 30 organisations and 200 individuals, and they've announced quite recently over 250,000 hours have been donated to developing the site, and a lot of that is pro bono work, legal work, financial work, looking at things like moderation, privacy, security. They've put a lot of thought into the GDPR aspect. So it's a site that both is using that donated time professionally, but also you can become a friend on the Cancer Central site. So you can leave dedications to people. It's got a very personal, empathetic aspect to it, and you can become a friend and donate, as well as accessing services.
So I think perhaps a significant proportion of people looking for this kind of service might not be all that tech literate. How is the platform in terms of accessibility?
I'd say it's pretty accessible. I mean, I for one get pretty frustrated if IT systems are not accessible. In fact, I can get borderline.
Yeah. Well, there's no excuse for it in this day and age, I don't think.
I just dismiss them and delete them. But I think Cancer Central has got a very clean website. It's really thought about accessibility. They've thought about data privacy. At the moment, it's got, the search engine is very clean but straightforward. It's quite Amazon style actually in terms of what you put in, the search criteria. And I would say I would feel comfortable suggesting this to someone, in particular maybe someone who isn't tech literate, because it really pulls together things that maybe technical whiz kids can find themselves via Google, and persistent people. But if you're in a rural community, or I think my mother-in-law, for instance, would find this quite easy to use.
So how does Cancer Central support asset-based approaches to social care?
Well, they've got a long-term strategic vision to actually use their analytics to identify gaps in the marketplace, and to identify where geographical areas or particular cancer diagnoses don't seem to have services. So it's both looking at it from the perspective of the cancer diagnosis, the stage of cancer, and also where you live. And it sees that obviously the more that more people that get involved with it, it's got a hashtag here to help. Obviously that will come through the strength of the data, but they've certainly got a vision to be supporting commissioners through identifying gaps in products and services.
Fantastic, thank you. So thank you very much, everybody. Today we've heard from Katherine, Sarah and James, and we've talked about a wide range of digital health platforms, including Health Unlocked, Cancer Central, and of course the excellent resources that are available on the Mind website. For more information, please do get in touch with us.